it's PowerPoint. But look at that's Anaheim.
Huh?
I did like a cool like time lapse. Oh. All right, this episode is brought to you by Empower EMR. If your clinic is stuck in an EMR that slows you down, Empower gives you speed, clean workflows, features PTs actually asked for. Wouldn't that be great? Better notes, faster documentation, and smoother operations, all wrapped in customer support that doesn't ghost you. Check them out online, empoweremr.com. That is empoweremr.com. Disasters. They don't ask if the system is ready. They expose whether it is. It's like bar rescue. It's a stress test. It's gonna go sideways. Just figure out where it's gonna go sideways now before it actually goes sideways. Our next guest is pushing physical therapy into emergency response, disaster medicine, and primary care chaos where it's already desperately needed. Live from Anaheim, this is Megan Mitchell back to the show. Megan, welcome back.
Well, thank you for having me again.
The first time we spoke, I had never thought or never anything that PTs could or should be where you are. I was like, didn't know. And I love when I sort of have that little moment where I'm like, ooh, never thought about that. So let's start. Why is disaster response everybody's problem, not just specialists? Why is it all of our problems?
So I think it's important to remember that disasters impact everybody. They don't pick and choose. They don't select who gets impacted. It's widespread and it takes down everybody. So within the United States, I think what we need to reflect on is that the frequency of these large scale disasters, these 1 in a million sort of events, are happening at a higher frequency and they're reaching a lot more people.
Which is great.
Including PTs. So we're seeing everybody getting impacted, and then we're seeing all of these downstream effects from the lack of engagement from the PT profession.
Why is it all of our problem? And that kind of guessing from your response, because it's happening more, and like we're either going to get run over or we lean in to prevent being run over.
Every single disaster, if we look at just scale and scope, is in every part of the environment that we work in. So it's hospitals where I tend to lean into. It's nursing facilities, it's school-based settings, it's community settings, it's rural spaces and large population centers. So
understood.
Everywhere.
Good. There's a reason. Where is PT underutilized during disasters specifically? Where could we be more helpful?
So within the United States, we're not included in any of the planning or response operations, but we really should be engaged up front in the planning roles, in the pre-hospital receiving side of things. Those of us who work in the emergency department need to have a direct role in response to share that care burden between our critical care providers and those who are non-critically injured but still have an injury, and then all of the downstream locations, so hospital decompression, rehab centers, specialty rehab centers, and then even into the home health setting.
We help. We speed things up.
We speed it up. We decompress the
lighten
system.
The load.
We provide the right care at the right time for the right patient population.
Yeah, you brought up emergency department. I had never thought of that because I was a second career PT. I was like, I don't know where these things are. And then I listened to Rebecca Griffith for a hot 10 minutes, and I was like, oh, this makes sense. I get it. That makes sense. I like that. How come we're not doing more of that? And of course, that's your mission, and her mission is let's be doing more of that. What skills? Let's go in. Someone listening going, okay, but not me because I don't have those right skills. What skills do clinicians already have that translate to emergency care that people are probably, I don't have that, but they do?
So the thing is that you already have it. You're just not applying it fast enough. So the vast majority of all injuries in any kind of disaster, regardless of the hazard, is going to be musculoskeletal. And for those of us who work in the critical areas, the folks who have the catastrophic injuries will go inpatient to ICU level care where we're already providing care. But I think we need to sort of stop thinking about the large scale piece of it and remember that the one person in front of us has the most immediate need. A lot of those folks are going to be minor injuries with musculoskeletal being the primary.
Right. How can people look inside themselves and say well, I don't belong there because I'm not. What are the reasons they don't show up or they don't think they belong that you've seen?
So I think that people actually do think that they belong there.
Good.
There's just no identified location for them. So I think
no door.
There is a door. We just didn't know what it was.
Got it.
So you can't just volunteer in a disaster and say, I have these skills, I have my licensure, I can help with all of these things. that is generally not well received by the folks who are running the show. And so you really have to engage ahead of time with organizations like the Medical Reserve Corps, or within the hospital, you have to work on your emergency response team so that people fundamentally understand where your skills are and they can check your licensure ahead of time so that you've been pre-vetted in order to engage.
Don't just show up in the middle of the fire and be like, I know how to hold a hose. Be like, my man, you got to show up before that. And
yeah, nobody cares in the moment.
get out of the way. You're slowing me down. So show up before.
You got to show up ahead of time.
Be part of the team.
Yep.
Right.
Understood. You got to train. You got to speak the same language.
Why aren't PTs consistently included in disaster planning? Are we just not raising our hands enough to be on the team? Is that,
this is kind of a loaded question. So I think there's a lot of it that people don't understand that they can do it. But on the other side of it, I don't think a lot of our colleagues within emergency management or emergency medicine really have a good understanding of our skills and our scope. So they're not writing us into the plans because they just don't know how to use us.
But someone else not understanding where I might have value, I might want to take a little ownership of that and say, let me show you this, how I might be able to help. Tell me what problems you have. Let me see if I could help. Instead of just saying, they don't think we're valuable.
Yeah.
We're locked out of the team. Why aren't you letting me in? It's like, hey, man, did you explain it in a way they could understand?
If you give the ownership of writing your response to somebody else, they're gonna do that with what they think that you do, which tends to be a lot of like move patient from A to B and then get out of my way.
Right. And please don't do that. Like just communicate clearly.
If you don't want to be in the disaster in the front line, by all means, like move patients from A to B. But if you have the skills and you're ready to step into that space, you've got to take ownership of your own professional voice. Understood.
So let's break this down. I like things when they're actionable, or a PT we call it, like Monday morning applicable. What's an actionable step clinicians can take to prepare? Where, like, if someone's nodding along going, cool, I've heard of this. Now it's not really on the fringe. Now I'm starting to hear about it more. Where do you tell them to go or do? What's step one?
Step one is connecting with your emergency manager, whoever that person is. Sometimes it's a director of safety. Sometimes it's an emergency manager. It could be your environment of safety person, whoever writes your disaster and emergency plans for your facility. It's required by law for anybody who receives federal dollars for healthcare. They have to have both a disaster plan, including an evacuation plan. And I would say sit with it, read it, and then look at those plans through the lens of a PT.
There it is.
Where do I apply myself and how can I better this process?
Like that. Smart. How does advocacy intersect with emergency response? Is it everything you were just talking about? Is it showing up and asking how I can be helpful and making sure people understand that you're there?
I've stopped asking how I can be helpful. Okay. I have started asking, where do you need, where are the gaps in your response? So we really need to change the conversation from lessons learned into lessons applied. And so we know from all of the events that have happened before, there have been gaps in the response, there's gaps in the operational planning, and then where do we fill in those gaps going forward? Yeah,
any resource, I like tactical things, PTs love brochures and websites and whatnot. Where are the good resources? Where can people go to find out a little more, inch a little bit closer to the end of the diving before they take a jump?
We put out a brand new updated emergency response guide through the APTA that came out in October. And it has a whole bunch of resources on there, both for incident command education as well as in-person training.
APTA where? Like through what academy? Where are they going to find it?
I think it's through the federal,
Federal.
The C-suite folks.
Got it. It's the fancy people.
The fancy people who get paid money to do this stuff.
It's their job.
But it's the PT and PTA emergency and disaster response, and there's a full action plan in there.
Perfect. There's a lot of things that APTA does that people have no idea because they don't know to go look for it, but now they do.
Now they do. All right. It's out there.
We have a tradition on the show. We call it the parting shot.
This is the parting shot. One last mic drop moment. No pressure, just your legacy on the line.
All right, your parting shot, I'm going to ask you the question and you answer.
Okay.
All right, so your parting shot, what's one action item every PT should leave CSM with related to disaster preparedness?
Everybody needs to leave CSM understanding that they have a role in disaster response, and preparedness is part of that sequence of events.
Yeah, we don't want a disaster to happen in your neighborhood, but that's where disasters happen.
Here.
They happen in people's neighborhoods.
Yeah.
If it happens in yours, Boy Scout motto, right? Be prepared.
Exactly.
Megan, where can people connect with you?
So you can reach me through my university website. It's through megan.mitchell@cuanschutz.edu. It's through University of Colorado.
Love it. Megan, appreciate you coming on the show. Here we are live at CSM.
Thanks for having me.